it's really important to engage the family in treatment. And I think we do a really good job of reaching out to the family, making the family part of treatment, encouraging family participation. With family support, outcomes are better. And it's not easy to do that. You have to really be committed to having a program that's going to do, it's complex to have family involvement. You do have to preserve privacy, confidentiality, but at the same time, if you can get the family involved, the outcomes are better. So that's a commitment that I see here at SunCloud. We also believe that addiction is a family disease. Now, this is important because it's not the same thing as blaming the family, or this is mom's fault, or this is dad's fault that their child has an addiction, or it's the husband's fault that the wife has an addiction. It's recognizing that addiction is in the context of a family system or a group. And it's also why I think it takes groups for people to recover. And so many times treatment fails is because the person's group that they exist in, that they live in, that they spend all of their time in, that doesn't get addressed while they're in treatment, and they get better and they go back to the same environment and nothing's changed, and then they relapse. So if you involve the family, you get better outcomes. It's hard to maintain a non-judgmental stance when you work with addiction and families who are furious because of what's been going on. I mean, we're not talking about, minor violations of boundaries that go on. But to be able to that's hard to do, but it's really, really important. When people don't feel judged and they feel like you're listening and you really want to understand where they're coming from, they'll begin to trust the process more, they'll open up more, and they'll get more out of treatment. Someone who is struggling with addiction, struggling with trauma, they have been pretty harsh on themselves usually. They're pretty judgmental of themselves. It's not helpful to add to that, in my experience. They don't need any more judgment or negative reinforcement. The idea that negative reinforcement will help somebody get sober or get better. They just punish them enough. If they're already suffering enormous negative consequences and yet they continue to use the drug. So negative reinforcement doesn't work. So in my experience, an empathic, non-judgmental approach is really the best approach.